Welcome to Syntegrity's MyRBQM Academy, the institutional education dedicated to risk-based quality management in clinical research. Founded in 2019, MyRBQM Academy offers specialized training in GCP-compliant RBQM implementation for clinical research teams. Led by industry experts, the Academy ensures study teams understand and apply RBQM effectively to improve clinical trial success. The RBQM Essentials Belt series offers certified courses beyond basic regulations. The courses teach change management, team tools, and practical implementation. Like Lean Six Sigma, the series has a tiered belt certification system where participants advance from white to black belt across 3 stages. Welcome to RBQM Essentials White Belt training. Completing this training will allow you to describe the benefits of risk-based quality management and quality by design compared to the traditional reactive approach to quality in clinical trials. It is an introduction to the world of risk-based approaches based on the GCP ICH E6 and E8 guidelines and will help you to contribute to your organization's successful trial execution. In this course, our expert instructors will guide you through the challenges with the traditional approach to quality and the regulator's requirements and will challenge some of the myths about RBQM and QBD that you may have encountered. This training is divided into 5 chapters, each featuring a lecture followed by practical exercises. At the end of each chapter, these exercises allow you to reinforce your newly acquired knowledge. But don't worry, these are simply a knowledge check and won't be scored. The exercises are designed to be interactive, enhancing your grasp of the material. Once you've completed all the lectures and practical tasks, you'll move on to the final phase of your RBQM Essentials White Belt training, the multiple choice examination. To earn the RBQM White Belt certification, you'll need to achieve at least a 70% score on the exam. And now it's time to meet your instructors.
Hello, I'm Keith Dorricott. I'm a Lean Six Sigma Master Black Belt, and I assist and advise many organizations on the practical implementation of RBQM.
Hello everybody, my name is Johann Proeve. I'm the Chief Scientific Officer at Syntegrity. I worked 36 years at Bayer Healthcare in clinical data management and headed the global data management organization at Bayer for the past 15 years prior to joining Syntegrity.
Now that you know the format of this course and have met our instructors, it's time to begin your RBQM Essentials White Belt training brought to you by Syntegrity's MyRBQM Academy. In this introductory video, our RBQM expert and lead instructor Keith Dorricott will introduce you to the course objectives.
So here are the objectives of the course. Once you've completed it, you should be able to describe the benefits of quality by design, or QBD, and risk-based quality management, RBQM, in reducing and controlling risks, and the limits of the traditional reactive approach to issues. To recall the key steps of RBQM required by GCP, or good clinical practice, and to name some of the myths about RBQM and QBD and the reasons they're not reality. This is the agenda for the course. We'll start by looking at the traditional approach to quality in clinical trials. Then we'll look at what the regulators have to say about risk-based quality management and quality by design in clinical trials, and how they suggest these are implemented. We then look at some of the changes this means to the traditional approach, and some of the challenges that change brings. To quote Charles Darwin, "It's not the strongest of the species that survive, not the most intelligent, but the one most responsive to change." In Chapter 4, we challenge some common myths in the industry about QBD and RBQM, and finally there's a summary. So let's begin.